Hi everyone. Today I wanted to talk about hair loss. Hair loss is a huge issue and common symptom that we see in PCOS, and there's very many different causes that it can come from. So it might not just be one cause with PCOS, but we need to look at a few other aspects of your body and what's going on inside there to see what the actual true cause of your hair loss is. So today what we're going to talk about is a few different causes of hair loss and some of the treatment options that we can consider when thinking about hair loss in general and using natural treatments, for example. Okay, so let's talk about the first one. It's called androgen excess. So when we talk about androgens, that's high testosterone. So it's commonly referred to as androgenic alopecia, so testosterone-related hair loss. And so one of the biggest factors is this testosterone that we create called DHT. This is a very potent form of testosterone that actually comes from testosterone in general. And we often see this in PCOS and also in perimenopause when estrogen levels start to decline and androgens start to go up a little bit. And so testosterone can actually cause oxidative stress and inflammation in the actual follicle and cause the follicle to fall out. The common pattern that we see with androgenic alopecia is your hairline. It will be like more parted. So you'll start to see your hairline kind of come apart. And then oftentimes the like actual hairline is okay, but just like right after it is where we kind of see the hair loss happening. The other thing that's very common with androgenic alopecia is an oily scalp. So keep that one in mind too, because testosterone can cause oil production as well in the follicle. So that's one that's very specific to PCOS. The second cause is low iron. And so oftentimes if you have heavy periods or if you have fibroids or if you're in the postpartum period after pregnancy, this can be a very common cause of hair loss. So it's very important to get your blood levels tested, and oftentimes you want to test ferritin. And you want ferritin to be around like 70 or even above 80. Anything above 80 is good, but even below that, your hair can enter into the telogen phase, and that can actually cause the follicle to fall out within a few months. And it's usually in like about 3 to 4 months that the follicle will fall out. Oftentimes, this type of hair loss is like a diffuse thinning of the hair all over, and your hair can be brittle as well. So that's like one big, huge sign that you should really look out for, because it's an easy fix with adding some iron into your supplement regimen or even increase the amount of protein that you intake on a daily basis in your foods. Okay, so let's go on. So the other thing that could be a cause is hypothyroidism, so your thyroid. And this is typically like a diffuse all over kind of hair loss. And so your hair can also be brittle and coarse. And it's often seen in like even hypothyroidism or even Hashimoto's thyroiditis. So that's really important to look out for. And there's a few nutrients that I'm going to talk about that can help with that. The fourth thing, so we talked about androgenic alopecia, iron, and your thyroid. So the fourth thing is stress. So chronic stress can actually lead to something called telogen effluvium, and that's when the hair falls out within a few months after a big stressful event. And typically it's around 2 to 3 months. So cortisol is actually linked to the phases of the hair. And so what can happen is if you're producing lots of cortisol, your hair follicle can enter into the telogen phase. And once that happens, the cell or the hair follicle is programmed to fall out within a few months after that. So the type of hair loss we see, the pattern is more like an all over loss, and sometimes even in like the temple area on this side. And sometimes what can happen is it can cause heavy shedding. So it's kind of like really fast, the hair falls out within a few like months or weeks even. And so it's really important to think about that one too. So that's like 4 things I would really consider as the cause. So androgenic alopecia, iron, your thyroid, and chronic stress or stress in general. So let's talk about some natural treatment options that can really be supportive for hair loss. So one of the biggest things is making sure you get enough protein, because protein is really important for that iron piece. So, when we talk about hair loss, it's really important to figure out what is the cause, and then really treat that cause. So if it is iron, then definitely making sure you get enough iron as a supplement or in your diet. And if it's, androgenic alopecia where you have high testosterone, oftentimes like botanicals can help here, like saw palmetto, but also even things like zinc can help to reduce testosterone levels. And then, overall, if we're just looking at hair loss and thinking, okay, what are like the top supplements to take in general, the first thing I would suggest is just like or even just talk about, is an antioxidant. Antioxidants are really good for the hair because they decrease inflammation in the scalp. So these are supplements like vitamin A, C, E, selenium, and zinc. These are like the top antioxidants that we can use. But also, zinc and selenium are really good for any thyroid condition. So that's important to consider as well. Vitamin D is also very important. It's really good to maintain any inflammation that could be there. And then also an omega-3, like a good fish oil, because fish oils are known to reduce inflammation and can be kind of like an antioxidant to the hair follicle as well. So we talked about protein, fish oil, a good antioxidant. Even B vitamins can be really supportive here because that can be helpful for stress management as well. And then, and then really like finding what is the root cause of why you're losing the hair, and then developing a plan based on what the cause is how you should go about thinking about your hair loss, and really talking to your family physician or naturopathic doctor to develop a plan based on what the cause of your hair loss is. I hope that was helpful. If you have any comments, just drop them in the comments below. Take care. Bye.